Hi, my name is Shesti. I've been a nurse for almost 8 years now, going on 9. And I started out as an LPN. I went to uh, NSU, started my prerequisites, found out that the nursing classes were full, so I had to go get my LPN and wait to come back later and get my RN, and I just finished that. I've gotten a lot of experience in the meantime. I've worked med surge, which is hospital floor where you normally go just to be admitted for something like pneumonia or something not too acute like the ICU or the telemetry floor. However, I got floated to those floors often because we just were low on staff. I worked there for a little while and then went into cardiology. I worked in a clinic as an LPN, did a lot of heart procedures tests like stress tests and stuff like that, and I really enjoyed that. If you would want to be an LPN, you would be a nurse most likely in the clinics, like I said, on the med-surg floor. You could do a lot of different things as an LPN. It's in surgery, you could do a scrub tech, which is actually you have your hands on the patient. The RN in that case usually circulates the room, makes sure that the paperwork is done and gets instruments for the surgeon and such. But if you decided to go on and get your registered nurse RN degree, you can get an associate's, bachelor's, master's, and keep going, be a nurse practitioner, flight nurse, nurse anesthetist, nurse practitioner, whatnot. Which is what I've decided to do after all that time. You get paid a lot more, but I still really enjoyed being an LPN, and that's why I was one for so long. Now that I've completed my nurse registered nurse degree, I'm now in the emergency room at St. Pat's Hospital in Lake Charles. I see a lot of crazy things there, see a lot of acute patients, but one thing I just kind of want to brush over that I've seen a lot of, especially in young people, is attempted suicides and substance abuse, whether that be alcohol, but mostly it's not alcohol that they come for. My latest patient was very young, in her 20s. She came in unconscious because somebody found her on the floor. They couldn't wake her up. They gave her this medication that reverses the effects of narcotics, and she was briefly awake and started to breathe, but it was very slight. So they brought her into the emergency room, and we hooked her up to the monitors, thought she was okay. A few minutes later, I noticed her heart rate was dropping. Her oxygen was like 70%, which is really bad. We went in the room and nearly had to intubate her until we figured out that she did not take the substance that she thought she had taken. She thought she had done a line of cocaine, and in fact it was heroin. So when you do heroin, it acts kind of like a narcotic that you would take for surgery or something. Just overdosing on something like that, which stops your breathing, it can stop your heart. You think you're going to get a great high, and unfortunately that's not the case. Most likely somebody told her it was one substance, so she would pay more for it. They got more money out of her and nearly killed her. This happens every single day, multiple times in just Lake Charles. And we only see half of those. They go to other hospitals there as well, and all day long I'm getting young people in who are nearly dying, and not because they wanted to, it's just because they took too much, just trying to get high, trying to get their next fix of whatever it is, meth, whatnot. Meth eats your skin alive. You literally get eaten from the inside out, even though you may feel great at the moment and, feel elated and have all this energy and get skinny and everybody wants to do meth. It's great. No, it literally will eat you from the inside out, and you will look 30 years older within just a couple years of using it. So eat your teeth away. Yes, it doesn't matter. People die of accidental overdose every single day, and it's very upsetting. A lot of times it starts with a mental health problem that starts from childhood. They saw some stuff that they didn't need to see, that unfortunately children have to go through every day, and get abused or or like I said, just see things that they don't need to see. And it starts with that. They try to cover it up with alcohol and eventually drugs. They try new things, or just recreationally, they go to college, think they're going to be on a great path, start doing parties and fraternity and get into some stuff they shouldn't get into and end up in the emergency room nearly dead, or they end up dead. Sometimes they make it, sometimes they don't. A lot of these patients, once they do finally get somewhat clean, they try to live a better life, but then that substance brings them right back because they hang out with the same people. So we have a room in the back of the emergency room we call the psych room. It's for people who are drunk, we have to just sober them up so they're safe and they can leave safely. Or it's those that are trying to hurt themselves or have, nearly succeeded doing so. And at that time, the doctor will do what's called a PEC, which is a physician order where you have to stay for several days either in the hospital or at a psych facility to make sure that you're not going to hurt yourself or somebody else. At that moment, all of your rights, not all of your rights, but many of your rights are taken away as a patient. You don't get to just leave. You don't get your cell phone. You don't get your shoestrings. You can't have your own pants on. You get in paper scrubs, and we have to watch you pee. Everything you do, we can't take our eyes off of you, and write down everything you do for 3 long days, and it's great. So don't do drugs. Don't. Alcohol is also really bad when people just abuse it. If you want to have a couple drinks, whatnot, fine. Make sure you trust the person that you're going with. And make sure that if you see someone who is passed out from alcohol, you probably should just lay them on their side, call 911, make sure they're still breathing, and that way we can get them fixed up safely rather than just letting them sleep it off, because a lot of times they'll vomit in their mouth, they'll aspirate, and they'll die suffocated, and that's just a life lost that shouldn't be lost, especially when they were just trying to have a good time, and we understand that. And if for some reason you do find yourself in with drugs, in with the wrong crowd, and you need to come into the emergency room, please do not be afraid to tell the medical professional that you are using some sort of illegal drug, because we are not the police. We do not call the police. If we did call the police, they wouldn't come arrest you anyway, because you were not doing anything at that moment for them to be able to prove. So anything that you are doing, do not lie to your healthcare professionals. Say you don't drink, you don't do drugs. If your parents are in the room, ask them to step out and you just want to talk to them privately. Tell them everything you're doing, because something that we give you may kill you if you have some drugs in your system. Also, something I just wanted to touch on briefly is STDs. It's a terrible subject. People aren't comfortable with it, but it happens. The moment it happens, you have unprotected sex. It, comes sometime in life that you're going to be sexually active, so make sure that you know who you're with. Don't just go on a one-night stand, even though it sounds adventurous. You need to be able to talk to that person seriously before you get into an intimate relationship, because if you come into the emergency room or into a doctor's office and think you have an STD or just want to be checked to make sure you don't, they're going to stick swabs in places you do not want them, and they're going to take blood tests that you don't want as well. And just save yourself the hassle, and make sure you use condoms, or be abstinent altogether if that's what you wish, until you know the person very personally and you can ask those questions and not be afraid to ask those questions. Also, I think that's about it. If anyone has any questions and need my contact information, you can ask Angel. She's my sister. She'll give you my info, and I'll help anybody I can out with any questions about college, how to get there, what route you need to take, places that you want to work. Nurses talk to nurses. We know where to work, where not to work, who to trust, who not to trust. So make sure you have a circle of friends in the area that you would like to go. When you do go to college, please be safe and enjoy yourself. Thanks. here is the trauma room of the ER. And over here, we have a cabinet with sterile instruments. We have this machine here that shows us your vocal cords we need to intubate. That is a ventilator, a crash cart, some monitors, and a lot of bougie stuff, including some bougies. That's what those are. They're actually called that. And that's an EKG machine, and we're going to show you what to do with that. Hey guys, I'm going to do an EKG, show you how that's done. These stickers are going to go on my patient's right and left arm, underneath the left breast, up on top both, and then on the lower legs. So I'm going to get started. Okay, cut it. Okay, so now we just wait till we have a very pretty EKG line going here. We have a little green dot. Her heart rate 66 beats per minute. So we're just going to push this little EKG button and it pops out the side after acquiring 10 seconds of data. So it's going to show what her heart rate is, make sure that everything is normal with her electrical system. And after it prints out, we can see a perfectly normal sinus rhythm, normal EKG.